Hello, good morning, everybody. Hi, I'm Andrew. Good to talk to you folks. On Saturday, hold on, let me set up the Facebook one too. I'm Andrew. Good to. So we have also some Facebook people coming in, and so I want to make sure that is all set up. And it's good to see like Gordon here, people from Hawaii, from Los Angeles, Vancouver, Philippines, all different places. That's so wonderful to see you folks. Today's webinar is really going to be very, very important because we have lately got a lot of pre-diabetic patients comes in, and also many of them already is the early stage of diabetes. And they were all worried about, hey, what would happen to us, in about a couple of years, or if I continue this stage. And I had actually encouraged them. I said, look, listen, you can actually really change this whole situation if you catch it early. Because what happened is, even though right now you are already in early stage diabetic, but within that 1 year, if you convert it, become a pre-diabetic, most of the doctor was going to will not written you down as a diabetes. So net result, you will be basically have a much better chance of getting yourself into a much more better condition. So basically, that was the idea. And I think that would be really good if we can do that. And so I thought that perhaps we should continue to drive people to get more into the sort of the into the diabetes pre-diabetic stage. So that would be really super good if we can do that. I think that's what my objective is going to be. And I know people might have questions later on to ask more information. That's okay. We can answer you further more information later. But meantime, what we're going to do, first step is let's get our lecture going, and we'll go from there. 各位朋友，我係 Angela Lowsutea President。今日講嘅節目咧係好特別嘅，因為現在呢幾排咧有好多人咧就問我呢個問題。喂，我依家已經係前期患病咯，或者已經啱啱轉咗去糖尿病啦。咁我將來2、3年後點算咧？咁其實好簡單嘅。因為如果你啱啱轉嘅時候咧，你係有好多機會咧，能夠令到你 reverse 翻去個叫所謂嘅 pre-diabetic stage， 即係前期患病者。咁你可能以後都係前期患病喎，但係唔好唔記得，如果以後前期患病咧，你唔會有好多呢啲咁嘅叫併發症出現，咁啊 save 咗好多錢，同埋你身體好多健康。咁呢個係好重要嘅。咁今日我就希望講多啲俾你了解多啲。So today our webinar are very much into showing you how to prevent you from getting to become a prevent you from become a diabetes if you are pre-diabetic, or if you are diabetes already, how to convert you back to a pre-diabetic stage. So that will be today's discussion. It's going to be a little bit long, but on the hand, it's going to give you a lot of insight and reminding you what's happening. So I go from here now, get slides. And if you can see this, will be really super. And so maybe Edwina, can you see any on my slides from the PowerPoint? And so maybe you give me a 1 if you can. And so that way I know exactly what happened. Okay, can you just give me a 1 if you can? Okay. So today's topic is pre-diabetic, how to reduce the risk develop type 2 diabetes. Now, if you have diabetes already, we also will share some information how do you reverse this. And so that would be really cool, isn't it? Okay, so today the topic we'll talk about what is 4 stages of diabetes, some statistic, and what is the pre-diabetic overview, how to diagnose, and what is the pre-diabetic risk, and measure some of the major risk factor, and tip to lower your developing the risk to become a diabetes. Now, you might say, hey, I'm already diabetes. No worry, because when you have this, the information you got today is highly related to the same information if you are diabetes already, how to reverse back to a pre-diabetic. So it's going to be a really good lecture to help you to remind you what you need to do. So no further today, I'm going to start off. Okay, everybody go through 4 stages of diabetes. I mean 4 stages. Now, the first stage, your LDL cholesterol goes up, and then will damage your B cells. The B cells, the cells of the insulin comes out to take the sugar into the cells. So if the B cell damage, the sugar is not going to the cell as a fuel energy for your cell. So it accumulates sugar on your vessels, continue. And that result, the cholesterol and the sugar get together, your blood becomes thick. And that is the problem that come in to drive you to stage 2. Because in stage 2, what's going to happen is your blood becomes thick, and you know what? You will start getting plugs everywhere, to the brain, to the heart, to the kidney, to every entire body. And that's the most important issue for all diabetes. And then if you don't do anything, the stage 3 to come, the blood sugar continue goes up. Now, everybody have this called hemoglobin here. Is a red blood cell carry oxygen everywhere. And a doctor will measure the percentage of sugar that attached to your hemoglobin. And if you have 5.7% attached, you know what? You're a normal person, lower. If you're over 5.7 to 6.4, you are pre-diabetic. And if you're over 6.4, you are diabetes. Now, unfortunately, if you are pre-diabetic, you have no medication to take. The doctor will just say, hey, you're getting pre-diabetic, you got to cut down your sugar intake, da-da-da-da-da. But the problem, majority of people don't understand, 80% as studied don't even know what to do. So that result, they continue lifestyle. That result, 3 years, they will go to stage 4, become a diabetes. Now, that is really sad, okay? So net result, the reason why I want to make sure now, alert everybody when you are basically, your LDL cholesterol goes up, your blood pressure goes up, you need to start doing something with it already, like drinking Lowsutea, exercise, whatever. I will show you more, but this is the message that we want to make sure you already know. Don't think that, oh, I need to really have diabetes or pre-diabetic before I do something. Well, hope you not, because you will be very quickly surprised. You will switch very fast. 嗱，各位朋友或者朋友啦，咁其實咧每個人咧都有4個 stage 咧係去 become 一個 diabetes 嘅。咁多數嘅人咧就係第一，佢 LDL cholesterol 上去先啦，咁佢咧就會損壞咗嗰啲B cells 嗰個由胰島出嚟嘅 B cell 帶啲糖入去細胞裏邊嘅。咁啲糖唔帶入細胞裏邊咧，糖越整喺血管越高嘅喎。咁如果個 LDL 同埋糖加埋一齊咧，弊啦，嗰啲血就好結啊。咁呢個就大問題出現咯。咁你就 move 咗 stage 2，因為好結咧就開始全身係咁塞，塞咗之後咧，你血壓就開始上升。咁如果血壓開始上升咧，咁就以後將來咧10年後你個損壞就好大啦，因為如果塞咗之後唔翻轉頭嘅。咁然後咧，你就會第3個 stage 開始發現啦，因為你嘅血糖上開始一路咁上升咧，咁每一個醫生咧都 measure 你呢個叫hemoglobin。咁呢個 hemoglobin 咧就係一個血糖一個血嘅細胞咧係 carry 氧all over the body 嘅。咁但係佢咧就 measure 咧就係 amount of嗰啲糖黐咗喺呢個 percentage 黐咗喺呢個細胞 hemoglobin 度嘅。咁如果你 hemoglobin 咧又係5.7以下咧，你係 normal person 啦。但係如果5.7以上咧，弊家伙啦，已經係叫前期患病啦。5.7至6.4係前期患病，但係呢個時間咧有個問題，冇藥食嘅。醫生就話俾你，喂，你前期患病咯，冇食乜甜嘢啊。咁但係咧，原來80% 啲人咧都唔知咩嘢點解嘅。咁變咗 end up 咧，佢咩嘢都唔轉。咁3年後咧，你就去 stage 4啦，變咗糖尿患病者。所以咧，我現在咧講個 message 咧，如果你係 LDL cholesterol 上升咧，你就要可以做嘢啦，同埋你個血壓上升都可以做嘢啦，可能飲虛糖茶啦，或者係做多啲 exercise 減你嘅肥啊嗰啲，我應該會教你多啲嘅。但係呢個咧係好大幫助你，唔會 even 去咗呢個前期患病或者糖尿患病，呢個係重要點嚟嘅。Now, if you are really a type 2 diabetic complication, what problem that you're going to face? Wow, lots of problems. You're going to have risk of getting your stroke, you lose your memory, your glaucoma, you can be blindness, your pancreas doesn't work, you need insulin injection, you're going to have heart problem, and you're going to have coronary heart disease. That's mean you're going to have a heart attack. That's sad, man. With a heart attack, you die, basically. And your high blood pressure, your vessel become hardened, it's damaged. And also worse that you got nerve damage. Now, nerve damage, a lot of people don't realize it can affect your stomach, affect your bodies with sex life, and also worse that you have a heart attack, you don't feel the pain because of the fact that your nerve is damaged. If your lower extremity has been injured, it doesn't heal, and you're going to have your leg amputated. Now, with all the sugar is make your kidney work really hard, and it damage your kidney. 70% of the customer with diabetes will have some form of kidney disease. Net result, as a matter of fact, many of these, if you don't take care of it, you end up with need a dialysis. That's even worse. And certainly, you have pregnancy, you become gestation diabetic. There's definitely a strong risk. 30% of the diabetic patient has no sex life. The reason why they can't feel because they have the nerve damage. So it can be a very complicated issue. 嗱，各位朋友，如果你二型咧，你好多不同嘅併發症出現嘅。第一，你可能夠有中風危險啦，同埋唔記得嘢啦。嗱，唔記得係好常見嘅。你見老婆幫你阿仔食咗飯未啊？10幾廿次都問呢同樣嘅問題，因為佢真係唔記得。第二，眼有青光眼啦，同埋有白內障啦。第三就係佢哋嘅胰島素出唔到嚟啦，咁你要打胰島素啦。有個大問題咧，就好多係俾個心臟你塞咗啊，咁就 end up 就要有個心臟病發作啦。咁然後咧就會死嘅喎呢樣嘢，咁變咗就希望你唔會去到呢個情況啦。咁同埋咧仲有血壓上升啦，同埋仲有血壓上升之後啲血管硬化啦，咁啊好多問題會出現啦。咁同埋咧仲有咧就神經系統損壞咧，呢個係更加大嘅問題。因為就算你 heart attack 啊，即係心臟病發作嘅時候咧，你冇感覺啊。咁你唔知個嚴重性咧，所以你唔會睇醫生。咁好多時咧，你第二心臟病嘅時候咧，你個嗰個發生率就好高啦，即係多數死嘅。咁如果係咁嘅咧，有時整親你腳啊，你唔會好啦，咁你嘅腳會斬咗佢啦。咁同埋咧，仲有腎咧整壞咗要洗腎啦，同埋有如果你係懷孕嘅時候糖尿病咧，多數你以後都遲啲會有機會become糖尿病。咁仲有性功能冇咗，因為冇感覺。Well, really, how at the end of the day, Lowsutea helping you? Now, at the end of the day, Lowsutea can help you. Is only two things in there which are really exciting. One is guava leaf, and what guava leaf it does is slow down your sugar absorption in the vessels, and then secondly is bitter melon that increase the insulin sensitivity and take sugar into the cells, and then also excess sugar will dump off from the urine, and also cholesterol, and also salt. When salt removed, your leg will decrease the swellness, and also your blood pressure come down. Plus, is also helping with detox. So it's really an exciting and very simple but very good product. And majority of people take, wow, I love Lowsutea. It tastes really good and drink whole day long. It's not a drug, it's only a fruit drink, basically, a vegetable fruit drink, you can say. So it's very easy. 嗱，各位去糖茶點用嘅咧？其實有兩種嘢嘅，一有個係叫番石榴葉啦，就將啲糖delay 咗佢入去個血管裏邊啦。第二樣有個 bitter melon 就係苦瓜啦，苦瓜就 increase 嗰個糖嘅胰島素嘅敏感度啦，咁帶翻啲糖入去細胞裏邊啦，咁你有糖用啦喺個細胞。咁第三咧就係佢最好咧就將嗰啲冇用嘅糖同埋嗰個膽固醇同埋佢鹽咧掉咗出嚟。咁當你掉咗出嚟嘅時候咧，你個血壓會降低啦，同埋咧你亦都唔會有腳腫，所以係同埋仲有 detox。咁你喺度排毒喎，幾正，後生仔飲咗連暗瘡都唔見埋，咁啊好正啦。Plus, we also have 5 programs because diabetes is a lifelong disease. You have to be motivated, continue to remember, and so forth. So we have 5 programs continue to help you to understand how to manage your diabetes. Now, majority of companies out there just teach you how to eat, but we're not doing here to eat. We teach you how to about what you have to watch for, why you have to look for this, and on top of that, what things you have to look for as a disease process, like for example, what kind of signs for heart issue and so forth. We'll teach you all those good stuff. So the 5 programs, first of all, will teach you about dieting, drinking Lowsutea, eating low carb, low fat. We'll also have the exercise program, 10,000 steps per day. The next 1 week, you at least do 150 minutes of exercise. With weight control, teach you how to lower your weight. Webinar every week will give you that. And on top of that, we'll also teach you how to track your blood. Many of our customers now use the tracking blood with the ability, and it will be very, very easy. And they will say, wow, that is really cool because, you know, I can able to track my blood easily, and I can able to understand what to eat, what not to eat. And we use one of these things here as help you to track, and then you can measure. And I'm 5.9 right now, you know, you see? Okay, so we have all that. You can also use a phone track. So it's very, very easy to do. So this is really a systematic to help you to become better health. 嗱，各位朋友，我哋唔係淨係教你去飲去糖茶嘅啫，因為咧一個做糖尿病患病者，呢個係一世嘅病嘅。咁你一定要係繼續努力咧，係學習去點去管理糖尿病。咁好多公司就係教你點食，但係我唔係嘅，我哋係教你點管理。自己食啦，點去做 exercise 啦，點去做降低個磅數啦。聽我醫生講咗，每個禮拜一次免費嘅，by the way嚇。咁同埋咧，每日咧仲要教埋你點去觀察呢個糖。咁你可以用呢個 app 呢邊啦，好似頭先我度咗啦。我自己嘅糖咧係幾多啊？我係有依家係有5.9啊。OK，so it's pretty good， right？ 5.9。咁我哋會做晒呢啲咁嘅東西，教你點做嘅。我哋希望咧，你嘅 A1C 就算係10以上唔緊要嘅。希望跌翻嚟5.7以下，咁你話唔得嘅喎，咁高，唔係，我見到好多 base patient 咧，依家10以上已經跌翻去6啊，或者5點即係5.9以下啦，咁都好正嘅喎，即係變咗佢差唔多 1/2， 有啲係要去到係5.7以下啦，咁係 very good。我介紹6.9嘅，依家我5.6，so it's very good，it work。OK， 如果你飲氣糖茶 ，OK，so let's talk about some facts about pre-diabetic and some statistics, okay? So that will get some idea. By the way, United States, 96 million people, 1 in 3 are pre-diabetic. Imagine that, 96 million, my friend. Oh, that's a big number. 嗱，記住喺美國啊，已經係96個 million 嘅人咧，係已經係糖尿患病者嚟，前期患病者嚟嘅。咁係每3個人之中你一個已經前期患病啦，呢個數字好大。香港咧係2.3個 million， 即係230萬喎，哇，好勁喎 ，OK？So it is not a small number, okay? And 80% of the people in the United States do not even know they're pre-diabetic. That's even sad because if you don't know, you don't do anything. You will just continue to do the lifestyle and eventually just convert it. And people found out, oh, I'm already converted to diabetes. Oh, that's sad. So really, at the end of the day, even though you are pre-diabetic, please, you got to actually start knowing that and do something about it. And up to you to do it. And I know you can. And worse that 30% adolescents, young folks, yeah, and they also already in pre-diabetic stage. So meaning that either the diet or the whatever. So used to be only 40 people and up are pre-diabetic. Now it will go younger, 20-something are already pre-diabetic. So in the future, the health is going to be big different. 80% 美國人咧，原來佢都唔知道自己係糖尿患病嘅，前期患病嘅，同埋仲有30% 咧已經開始好年青化，所以其實呢個好大問題，因為香港其實都見到好多呢啲嘅，有30零歲已經開始有前期患病，嗰原因就係因為個 diet 啊，嗰啲食物啊太好啦已經 ，OK。So really, what is pre-diabetic? Okay, I will talk about that earlier. Remember your A1C, the hemoglobin, the percentage of glucose or your blood sugar attached to this hemoglobin, and then measure every 3 months to see where you're at. If your hemoglobin percentage, the amount of sugar attached is 5.7, you're a normal person, lower than that. But higher than that, 5.76, you're pre-diabetic. And if you're over 6.5, your A1C, you know what? You are diabetes. So very important when you go to ask the doctor, what is my A1C? Remember that, A1C or hemoglobin A1C. But most people just use A1C as the name to be used. 嗱，各位朋友， 好多人咧唔知道咧，原來咧每個人都有呢個protein 嘅血糖嘅protein 嘅 hemoglobin 啦。咁佢咧就呢個 protein 咧就係carry 啲氧氣咧成身行噶啦。咁佢就 measure 幾多個 percent 嘅血糖咧黐咗呢個 hemoglobin。咁佢就知道如果你 under 5.7係正常人啦，如果5.7至6.4我前期患病啦，過去到6.4咧就糖尿病患病者。咁個個人都 measure 呢樣嘢嘅，所以好重要咧。下次去睇醫生 make sure 問哇 A1C 幾多啊？咁醫生話你前期患病啦，可能6.3啦，或者6.2啦。咁你亦都知道喺邊度，咁你 make sure 呢個繼續降低 under 5.7。Now, why you become a pre-diabetic? Very simple. First of all, most likely you have your insulins are now being resistant. Now, remember earlier we told you already, your LDL goes up and start damaging the what? Insulin, the B cells. So the B cell is being damaged. It doesn't work anymore. You know what? You will start getting insulin resistance. So there's slowly the insulin keep coming up, but doesn't work. So net result, as this go on, you have your insulin plenty coming out, but doesn't work. Eventually, your blood sugar going to go up. So eventually, as time goes on, your pancreas is going to get tired and no longer produce the right amount of insulin. Eventually, because you don't have enough insulin to take the sugar into the cells, you will become a diabetes. And that is a typical normal story, okay? Simply, if you can able to basically continue to utilize the sugar in the bloodstream, then you most likely will lessen your chance to be diabetes. That's why some of the things at Lowsutea will help because it increase what? Insulin sensitivity. Even you are insulin resistant or less sensitive, increase the insulin, become more sensitive, and that result use up in the cells. 嗱，咩叫前期患病一個問題？頭先講咗啦，記唔記得？第一，首先咧就係你個血糖嘅膽固醇，記唔記得？膽固醇 LDL 上升，咁即係 damage 咗嗰啲咩啊 B cells， 胰島素出嚟 B cell。咁胰島素出嚟嘅 B cell 咧，咁咧佢就掹出嚟咧都唔 work 喎。咁你有個叫胰島素嘅抗拒啦。咁胰島素抗拒之後咧，咁講到好多胰島素出唔碌嘅時候咧，咁你血糖繼續上升啦。咁一路上升嘅時候咧，個胰島素一路出到唔 work 嘅時候咧，咁胰島素become tired 就唔出咁多，就出咗多唔 work 嘅時候咧，所以咧咁 end up 咧，你係個血糖一路咁高，咁你就變咗係第2型嘅糖尿病，因為你血糖跌唔翻落嚟啊。所以飲去糖茶會幫手咧，就係因為佢 increase 咗胰島素嘅sensitivity 嘅敏感度啦，帶翻啲糖入去，仲有咧啲糖。有 excess 嘅去尿啊掉出嚟，同埋個 cholesterol 掉出嚟，salt 啊掉出嚟，咁你三高都降低嘅，所以就變咗係好正啦。So really, how I'm going to be determined I'm a pre-diabetic? Well, pre-diabetic, first of all, you will possible the doctor will say, okay, I need you to look at your fasting plasma glucose. In other words, they will take some blood. You have 8 hours without any food, and then without food and drink. So I take some blood sugar, and check what is your blood sugar is going like. Okay. Now you might be usually if you are 125, then you are pretty good. Now you could be in Hong Kong, maybe is 5.6, 6, as long as not more than 6.4. Hey, consider you are considered pretty normal. But some people, if you are already pre-diabetic and above, your blood sugar, even fasting, might be over 140. Now, one more test is very important. As I mentioned, the A1C, because they would check the A1C is not only the time when you do fasting, but they also measure a 3-month average. Your A1C 3-month average will be like the amount of sugar attached to the cell, maybe 5.7. So you are still normal. But if you are over 5.7 to 6.4, you are pre-diabetic. If you're over 6.4, you know what? You are diabetes. Now, if I'm already diabetic, my A1C is maybe 7, 8, 9. But can I drive it back to 6.4? Absolutely yes. I tell you, a lot of people I working with drinking Lowsutea actually even as high as 10 and drive the A1C back to 6.4. Matter of fact, one of the client that you will see later, which he has to do insulin, but because of drinking Lowsutea, drive the blood sugar A1C back to 6.1. So really good, and his fasting blood sugar is 4 point something, so that will be excellent. And so end up decreases medication and also his insulin. So A1C is a 3-month average, which they always want to check, and the fasting plasma glucose is take you your 8 hours of food, what it's going to look like. That's how they check whether you're pre-diabetic or diabetic. A1C is a key determining factors. 嗱，各位點知我係前期患病啊？嗱，首先第一，佢一定係8小時裏邊唔食嘢咧，佢就抽咗血之後咧，就睇下你個血糖幾高。嗱，如果血糖咧你係過咗120或140咧，咁你就要真係好注意用咯。但係應該都唔係話最重要住，最重要 measure 你嘅 A1C， 因為佢係一個3個月平均數字嚟嘅。咁啱個 sugar 係 attach 你個紅血球啊。咁如果紅血球咧係多過5.7咧至6.4咧，你係前期患病，一定係㗎啦。咁但係如果 under 5.7咧就唔係嘅。如果過咗6.5咧，你就已經係糖尿病啦。所以變咗嚟講咧，最重要咧，佢就一定 measure 你嘅 A1C， 睇下你係咪前期患病。嗱，依樣嘢咧，每次去睇醫生都應該問下，喂，我 A1C 幾多啊？咁你就知你前期患病啊，因為係已經糖尿病病者，或者你係普通正當冇問題嘅人啦。Now, one of the things that really you ask, what risk do I got if I'm diabetic or pre-diabetic? Okay, the pre-diabetic eventually will become a diabetes. Got to remember that. You will, if you don't do anything, most likely in 3 years, you will be converted to a diabetes, and that's scary. Okay, so really at the end of the day, if you have a pre-diabetic, you definitely have a high risk of 2 major things. One is your heart disease, because as I mentioned, remember, the blood sugar and cholesterol become thick and it will plug everywhere, right? And it will plug everywhere the heart, and it will plug everywhere the brain. The more important is the heart, because then you will really, and the chances of heart disease is much higher than any other thing. Plus, it plugs into your brain, then you have more chances of stroke. So heart and stroke and loss of memory is really one of the things that you might be really at a higher risk. So gotta be watch that, because that is not funny. If you get a heart attack, you die, you disappear from life forever. You die, right? So don't get that stage. Treat it, so make sure you're safe. Okay. 嗱，前期患病嘅風險係點咧？因為你會轉咗，你會變咗 end up 去糖尿病嘅。如果你唔理嘅話，嗱，好多人都唔知喎，因為咧3年裏邊咩都唔理啊，most likely都要 convert 嘅，所以千祈唔好俾你自己去呢度。第二樣嘢，你唔好因為你 convert 咗之後咧，你一路發展落去咧就有高風險咧，就有心臟病。因為記唔記得啦，糖加埋嗰啲血糖加埋嘅膽固醇咧，你血變咁好結。當好結嘅時候咧，就全身係咁塞。如果係塞咗之後咧，你個心臟咧就會塞到嘅，同埋亦都會開始有機會中風啦，同埋唔記得嘢啦。呢啲係全部係一個好大風險嚟嘅。So at the end of the day, a pre-diabetic is a potential risk and can be a serious health complication if you convert to a type 2 diabetes. Now, a lot of people don't realize I'm a pre-diabetic. I have no feeling. I have no any medical issue. Why should I care? Well, that's not true, because in 3 years, you become a diabetes, and another 5 more years, a complication will come. So all these become a lifelong disease. And once you become the 5 years mark after you become a diabetes, you don't take care of it, and your blood sugars continue to be high, your health is going to be extremely continue to become poor and cannot reverse. You cannot just say, well, now I know, can I get some plug to go clean it up? No, whatever plug is plug, okay? I will give you an example later on a patient that who are working with, who are pre-diabetic. No, actually, he's a diabetes now, not a pre-diabetic. But the cholesterol is very high, and so he drank Lowsutea. We brought the cholesterol down to somewhere in the neighborhood of from 4 to 2. And so the American way is about 140, 140 all the way down to about 100 to 110, something around the area. But you know what? The cholesterol already plugged, so you really can't reverse it, and it's hard. Already coronary arteries have something 96% plugged already. So imagine that you can't really do that. So NLP has to have angioplasty. So you really cannot reverse it just by saying, okay, I'm going to bring my cholesterol down. It doesn't work that way. You have to continue work on all the whole gamut of prevent the pre-diabetic and diabetes. I'll show you a little more later. But we already mentioned this. You have all type of complication. If you don't do anything to it, you have stroke, cataract, pancreas malfunction, and you have insulin heart attack, high blood pressure. You saw this slide before. I just want to make sure you know this is the complication coming. 嗱，如果咩嘅唔理嘅二型或糖尿病咧，你就真係好弊啦，因為有好多併發症出現咧，腦啦同埋你有白內障啦、心臟病啦、血壓高啦、神經系統損壞咧、斬咗腳佢啦，同埋你腎病咧，你全部會有感染到嘅，即係你唔理嘅話，所以一個係一定好重要理嘅。So, but on the hand, a lot of people say, hey, I have no symptom. You know, why should I care? I'm not sick. I feel very healthy. I walk. I've been eating this whole day long, but nothing happened. Well, maybe because pre-diabetic usually have no symptom. Even the early stage of diabetes also have no symptom. Majority of them. Usually the symptoms are so mild that you don't even recognize, okay? And so you really have no idea you are actually really getting to be very sick until 5-6 years you already be a diabetic. Eventually things will come along, and most of the time people will have some like darker skin and armpit, and also on the neck, and then they have a skin issue, and also some of them the eyes become a little blur. But really, at the end of the day, some of the early symptoms are usually skin. I'll show you more later on. And everybody will have some of that problem start off. But because of the fact that it's so mild, you might be totally ignored. I'm just normal age. That's why my skin being dry. But if you have that, you got to start paying attention. 嗱，各位朋友，最弊咧，呢個前期患病好多時咧係冇乜見狀嘅，多數咧就係啲皮膚黑咗啲啦。同埋咧有啲即係皮嘅乾啦，咁其實咧同埋有陣時咧有啲人就眼矇啦，咁其實咧呢啲咧只係前期患病嘅症狀，因為咧呢啲係可能係嗰啲血管係開始唔係咁鬆即係唔係咁順暢嘅時候，就係腳所以變咗嚟講，你開始個腳好乾。咁啲人話乾啫，咁啊，梗係腦梗係乾㗎啦。其實唔係嘅，呢啲如果出症狀嘅時候咧，你就要開始咧，真係要開始注重嘅問題啦。So when you have pre-diabetic, you will start moving to diabetes. Other signs and symptoms will come up. Like for example, you're gonna start increased thirst, frequent urination. You're gonna get hungry real fast. You get tired very often. You start losing a vision. And then you have numbness and tingling of the hand and feet. And then you have also infection become higher in the leg. It doesn't heal. You're going to start getting sore, it doesn't heal. And then you start, sometimes they even don't lose, they have no intent losing weight, suddenly you lose a lot of weight. And you start getting kidney disease and heart disease. And that is all very typical for type 2 diabetes, when they start converting from pre-diabetic, getting more serious. Skin is one of the major frequent or common sign whereby your skin become very dry. Also some of the people start losing a hair over there on the lower extremity because of poor circulation. So dry skin and also tingling feeling is a common sign of pre-diabetic. Continue moving on to change of diabetes. So when you have dry leg, skin, hand, you may need to check, because you want to check, you have to go to the doctor, do a blood test, check your A1C, see where you're at. because you don't check the blood, you're not able to tell. So you got to check the blood work to able to understand where you're at. That is important. So do check your blood to see what is my A1C. Okay? 各位朋友，如果你可以轉由前期轉二型咧，你會開始有感覺咧，口乾啦，頻密去廁所啦、小便啦，成日食完嘢都會唔飽，要肚餓咁頭成日疲倦啦，同埋視野開始朦啦，同埋手腳咧有時刺痛或者有 tingling feeling 係好似唔覺得好似唔知點咁嘅 ，OK， 咁啊即係總言之感覺上好似有少冧冧地 ，OK， 因為咧你開始 nerve damage 啊，啲血唔係咁開始入到去嗰啲 nerve 咧開始 damage 咧。咁你就常常有啲嘢，咁同埋最弊咧，你可以感染之後咧，咁你啲 wound 又唔好喎，即係傷口唔好喎。仲有陣時咧，你係會有啲瘡出咗嚟咧，猛唔好嘅時候，你又要慢慢即係要處理佢啦。同埋最弊問題咧，你開始腎衰竭啦，或者你心臟有問題啦，同埋咧你有好多時咧，有啲人忽然間，哇！我冇減肥，我真係減得好緊要。其實all呢啲嘢咧係全部都係前期患病去轉二型患病嘅問題出現嘅。So who really at the end of the day have this kind of risk, by the way, because I'm a healthy individual. Now I just was told that I'm being pre-diabetic, okay? So why have this risk? Now, really at the end of the day, many of these people are usually 45 and up. Now, by the way, don't think that just only 45 is the marker, because now I notice a lot more people are getting younger and younger, get pre-diabetic, 30-something. And some even as high as 20-something, because our diet, our age has, because the diet of we don't move and so forth. So a lot of these young folks are being converted. So, but at least, if you're 40 and up, I better start watching, okay? 嗱，如果你45歲上咧，你就真係要睇啦，因為呢個係一個開始新嘅，呢個就 risk 呢種係開始個風險開始嚟㗎啦。因為老嘅時候咧，你好多呢啲咁嘅症狀咧，因為你個胰島素或者唔係咁樣咁好啊，或者又唔成日做 exercise 啊，咁你係肥胖啊，呢啲會嚟緊嘅。因為 so if you are also your family have diabetes, meaning that your father, mother, your brother and sister, your uncle, auntie, if they are, the chances of you becoming diabetes is really high. Last night I actually have a dinner. And basically, one of the client giving the lecture was telling me, oh, wow, my dad is diabetes, my mom diabetes, and my brother's in diabetes. And you know what? He is now being pre-diabetic. So it's very natural, okay? So matter of fact, I have quite a bit of other clients. I said, why you buy 4 or 5 bags of Lowsutea 60? That's a lot, it's like 6 months. I said, oh, no, I buy it for my family. I said, what? Your family? You mean? I said, yeah, my mom is drinking it, my dad drinking it, my brother is drinking it, my sister drinking it, my auntie drinking it, and myself is also drinking it. So basically, the whole family, because of the siblings who are all diabetes and family related, they all become diabetic. So keep that in mind. If you are diabetes, you better ask, is your mom diabetic or dad diabetic? If they are, you got to start drinking Lowsutea to help them. Okay? So 如果你屋家族咧係有呢個糖尿病咧，多數你都會有糖尿病嘅。所以要算啦，因為咧，如果你係爹哋媽咪有啊，或者你自己有啊，你姊妹多數都有嘅。咁要個個都要睇住啦 ，OK？ Also, gestation diabetic is a really issue because a lot of people don't realize if you're a baby, okay, I'm a mother, I'm during my pregnancy, I gestated, your risk is become a diabetes is very high. So you got to watch, because if not, you might be, you don't realize that you're gestated. Later on, you're going to get well, by the way. Many of these people, after pregnancy, the hormonal changes stop, so they got well. But they might convert it to be a diabetes down the road in 5 years or so. So you have to watch yourself. Don't think that you will not able to not become a diabetes, because you got to watch and just got to check, okay? 如果你懷孕嘅，你而家係糖尿病者嘅，但係當你懷孕完之後咧，你糖尿病會消失咗，但係要開始注意啦，因為呢個就係個 future risk 咧，你會變咗係糖尿患病者嘅。 Now, a lot of people don't realize, lady, they have a polycystic ovary disease. And so if they have that, that is also a high chance of diabetic. So if you have that, you got to watch. So in other words, if you have that type of problem you have, you got to ask the doctor, hey, check my A1C. I need to check on it. So make sure that every half year I have to check, rather than a few years to check, then you already have maybe diabetes. So all that, if you check, is very simple. That at least you check an A1C. Remember, check A1C. Then you understand where you're at. Okay. So 如果你有個卵巢咧，有好多呢啲咁嘅growth 喺個卵巢嗰度咧，咁你個咧就卵巢綜合症啦，叫咁呢個咧你就真係要咧去 check 多啲啊，因為你個 risk 係去糖尿病嘅發展咧係會有高啲嘅你個卵巢 ，OK？ 咁好多人都有嘅，因為好多女士都有呢個問題嘅，所以變咗嚟講要真係 check 啦。當你有呢樣咧，最緊要 check 一樣嘢 A1C， 同醫生講就 check A1C， 記住啊。Now, another one that is really the high risk is obesity. If you are BMI over 30, well, my friend, you're gonna basically cut down your weight. If you cut down your weight, you have less chances to form diabetes. Imagine 10% of weight lower, you have less than 1% A1C. But you are continued obese, the chance of you to become a diabetic is high. So keep in mind, lower your weight, my friend. So 肥胖係一個大問題。如果你繼續肥胖咧，你個 chance of 轉咗糖尿病係高嘅。OK， 記住。Now, if your lifestyle are continue to be don't move, I like to every day watch TV. I'm a TV potatoes. Wow, that would be terrible because you don't move, you don't burn up your sugar. Chances of you also become diabetes high. So this is a high risk. So make sure you gotta get your lifestyle, continue moving, continue to work, do more things, walk. Okay. If you are sedative, don't do that. Continue to do more things to move around. 嗱，各位堂友。好重要咧，就係要繼續喐嘅。如果你唔喐咧，弊家伙啦，因為你唔喐咧，就 end up 咧，你 burn 唔到 sugar 啦，咁你啲糖繼續喺身體喐，你琴晚度做嚟做去啦，咁 end up 咧，你就真係好大問題出現㗎，所以要好小心，繼續做多啲運動，喐多啲。A lot of people don't realize you also is a sleep apnea, meaning your over here it becomes very, very big and fat, and it's actually stop breathing. And a lot of time you have high, really snore, big sound. You most likely have sleep apnea issue. So you have to go to a doctor to check sleep apnea. So you have to have a machine to force air in, because if not, you might get stroke at the night of day. So very important. Correct the sleep apnea, because most of the people, by the way, 90-something% of people who have sleep apnea issue don't even know until they went to check the sleep and check with how they identify, they are basically not getting air into the brain. So it's because of the fact that over here is so fat to stop the air going into the trachea. So that is a big issue. So you need to have a CPAP machine to help you to breathe the force in. It's really good. After that, you're going to feel much more energetic. You're less likely to stroke. So if you're sleep apnea, also have a chance of you become a diabetes. 嗱，睡眠窒息症係一個好例子嚟嘅，因為你又要好肥胖啦，咁啲氣咧就走唔到氣管嗰度喎，咁好多時 end up 就有 stroke 啦。但係你咁肥胖咧，就 chances of risk 咧都係會有糖尿病嘅。所以如果你有呢個睡眠窒息症咧，你又要 check 俾醫生，喂，我有冇呢個糖尿病啊、前期患病啊？ Another thing that a lot of people don't realize, hormonal issue also as a condition could lead you to be a diabetes. So with that, you gotta be also check while doing a health check, especially lady. You gotta check that out. So with that, you gotta look again, ask what is my A1C, right? 嗱，荷爾蒙改變啊，有啲人好多人荷爾蒙泵咧。如果你荷爾蒙有問題咧，其實呢個亦都可以引致到一個叫糖尿患病嘅喎。 咁所以變咗你又要即係問下醫生，喂，嗰個 A1C 幾多啊 ？OK？ So now we talk a lot about your risk, which you might not heard of that before, but they are real risks. So now if you are in that category, you got to watch. But excuse me. But the most important is really you have to change your lifestyle and reverse if you are pre-diabetic to go further beyond. And so you won't be even pre-diabetic. Or you have diabetes already, you can convert back to a pre-diabetic stage. But more important, you will continue to drive yourself, not to drive your A1C over 6.4 to become 6.5. So you always delay your diabetic to type 2, your pre-diabetic to type 2 diabetes. Delay them, okay? Delay, that's the strategy. But you say, well, why have to delay? You know what? If you are pre-diabetic, you basically, your healthcare costs are very minimal. But your diabetes and continue to move up. You know what? You in a state, they were telling you, you will spend typically for a person with diabetes, you spend $16,700 per year additional healthcare costs versus a person that are not they are not diabetes or just pre-diabetic. So if you do it for delay 20 years, I just saved you $330,000. You can buy a house, you can buy an apartment, you can do a deposit. You know that? That's a lot of money. Plus, you won't be healthy. So do that, not to get yourself convert. Or if you convert it back so you lower your costs. So you have no more, all sort of medical costs. 嗱，如果你係前期患病人咧，就千祈唔好令到你轉咗去咩啊？糖尿病，因為如果你唔轉咧，因為係咁 delay 咗佢咧，20年後你本身係 save 咗係16,000蚊美金，即係話10幾萬一個年喎，10幾萬一年咧，如果你係有20年咧，你係 save 咗2.6個 million，260萬，哇！你可以做一個即係 deposit 係個首期，你嘅地產得㗎啦。咁你係咪更加好？亦都唔使使咁多錢，亦都身體健康，可以享受生活。哇，何樂而不為啊？好過你而家變咗係糖尿病啫，哇，好多問題出現，哇，千祈唔好制呢樣嘢啦。So how are you going to delay yourself? If you already diabetes, you can still do this to reverse back to your pre-diabetic stage. Certainly, one, you have to eat healthy food and reduce your carbs. And I would show you how to do that previously. I already showed you. Half of them are all vegetable. 1/4 is what? Is your fish, protein, low meat, low fat meat. And 1/4 is going to be brown rice, beans, things like that. So you continue lower your carbs intake. And also your eat portion sizes could be smaller. You can make a big plate, or you can make a smaller plate. So it's best to make a smaller plate so eat less, okay? So also your diet has to be more fiber. So fiber is limited your carb absorption, your blood sugar absorption. And also you don't want a lot of processed food. Like, for example, you don't want to go to eat a lot of processed hamburger, cookies and things like that. And one more important thing, drink a lot of Lowsutea instead of drinking water, because Lowsutea will help you continue to lower your blood sugar, lower your cholesterol, lower your salt, and lower your blood pressure, and detox. So drink plenty Lowsutea if you are able to lower your risk of diabetes. 嗱，第一樣嘢點去減低你個糖尿病嘅風險啊，或者你前期患病嘅風險啊？好簡單，第一，食少啲卡低碳水化合物嘅食物。咁其實係乜嘢啊？嗱，第一，我成日教你哋啦，一日點裏邊一半全部係菜沙律 ，OK， 1/4就係嗰個叫做食呢個好多呢個叫做魚啊。食4分一魚啊，低肥嘅食物啊， 同埋肉都係低肥嘅，同埋四味咧係食啲紅米beans咁嗰啲咪可以搞掂咯。咁原來食個碟嘅時候咧，最緊咧就係揾細碟嚟食，因為細碟好似食好多，其實唔係其實都係一樣嘢，唔好似大碟。咁你就食少啲喎，咁就係食好多高纖維嘢，高纖維嘢就變咗唔會食absorb好多嘅糖啦。咁同埋咧，仲要咧食好多唔係食嗰啲叫 cookies 嗰啲咁嘅嘢咧，咁你咧就變咗嚟講咧就少咗啲食物。咁仲有一樣嘢咧，就飲多啲去糖茶，因為去糖茶好當水咁飲，因為能夠令到你咧係降低血糖啦、膽固醇啦同埋排毒啦，就血壓，哇好正喎，3高都降低，仲係幫助你dilute咗啲血，能夠你個血唔會好結，咁樣啲唔怕塞。能夠更加身體康。Also, so important, a lot of people don't realize it's not only food, it's the exercise and stay active. Because when you are exercise, you burn out what? Sugar. So you continue exercise, burning out sugar will help you tremendously. Now, you may say, I am a pre-diabetic, why should I do that? I have no sign and symptom. Or I am a diabetes already, can I do this? Absolutely yes. Diabetes, pre-diabetic, everything is just the same. You have to exercise. If you lose 10% of your weight, you know what? You lost 1% of A1C. You know what? Your A1C is 7 or 8. You now will be 7. If it's 7, you come down to 6. Isn't that great? And really that's simple. Every day you do 30 minutes or more exercise. If you do 5 days a week, 150 minutes, man, you got it done. And then if you need to get a coach to help you out, that's fine. If not, that's okay. Husband and wife walk down the shopping mall. That's good enough. And every day enjoy the walk and see people walk to the shop and find out what is done. You don't have to buy anything, just to walk, enjoy the scenery or park, doesn't matter. 各位好重要，其實咧糖尿病者、前年患者係 same 嘅，你一定要運動同埋保持咧係活躍，喐嗱。如果你係活躍咧，你一定係 burn up 咗其他咧好多，即係消費咗好多糖走噶啦。咁如果你降低咗10% 嘅重磅咧 ，you know what？ 你低咗1% A1C。如果你每日做咗30分鐘嘅運動咧，你已經一個星期做5日咧，咁你 burn up 咗150分鐘噶啦，咁你係合格咗噶啦。咁同埋咧，如果你話每日哇，我想去揾個 coach 教下可以，但係更加好咧，日日行咧。去咩 shopping mall 嗱 ，shopping 又方便啦，又好啦，睇下啲嘢啦，哇，身心健康，或者行個公園得嘅，唔使一定 shopping mall，但係你繼續行，記住繼續行，咁你就更身體健康噶啦。So if you are a smoker, I hope that you can quit smoking, and you gotta drink moderately. As you know, smoking increases your insulin resistance and link to high risk of diabetes. And you drink alcohol, worse yet, because alcohol is not a carb, especially mixed alcohol like cocktail and so forth. You drink all kinds of stuff. So that all increase what? Blood sugar eventually. So if you can do that, you can quit smoking and drink alcohol very small amount. Because red wine and all other wine is the same thing. So if you get 1 cup of wine, wow, your blood sugar goes up higher. You only 1/4 cup of wine is so much better. So keep doing it, okay? 戒煙戒酒好緊要嘅，因為如果你繼續係食煙咧，咁就弊啦，因為食煙咧係增加咗胰島素嘅抗拒嘅。咁如果係咁嘅話咧，咁你個糖尿病個風險就更高啦。咁如果飲酒，有時飲好多酒咧係有 mixture 嘅，即係嗰啲烈酒咧係 cocktail 嘅，咁你就弊啦，又係增加你嘅上升嘅血糖喎。咁仲有啦，如果飲啤酒先咩有好多 carb 喺度噶嘛，咁一樣嘅嘢。咁變咗嚟講啦，紅酒都一樣喎。你冇諗啊，紅酒 OK 喎。嗱，你飲一杯紅酒 versus 飲1/4個紅酒咧係好大分別。因為紅酒有咩啊 grape 做嘅，即係有糖嘅，裏邊有葡萄嘅。飲多葡萄你嗰個 grape 就碎。我有個客咧係晚晚都好高啊。我點解？原來晚晚都飲酒。我當佢降低咗之後咧。Guess what？ 個血糖就唔高啦，所以飲酒紅酒嘅呢個人紅酒嘅係一個有好大問題嘅。So you also need to maintain a regular bedtime. The important thing is if you get enough sleep and wake up at the same time, the chances of you being bad in the sense of getting your blood sugar will be much better. Now, if you are stressed, like for example, I only sleep 5 hours, okay, and I'm stressed out, your blood sugar can definitely go up, especially in the morning time. Your blood sugar will go up as much as 140 and 8, something like that, okay? But you really gotta have enough sleep. The most you gotta sleep is 7 hours, and always sleep at like 10:30, 11 o'clock. Every day the same thing. I wake up 6 o'clock. Then you have 7 hours sleep. So that's really good. So make sure that every day you sleep the same amount of time, a little more than 7 hours, not more than 8. And then everybody sleep at the same time. It will be better for you. 嗱，瞓覺一定有好嘅規律，能夠瞓7個鐘頭啦。咁同埋咧就係睡眠嘅時候咧，你係由6，譬如你每晚都係10點半瞓覺或者11點瞓覺，朝頭早6點半起身 ，will be good。但係如果你瞓唔夠咧，弊啦，咁你就會好 stressful 啦，咁你個血糖一定上升嘅。如果你繼續 stress 嘅咧，就好大問題嘅，因為繼續即係stress 咧。好多時咧，你而家見到自己朝頭早啊，琴晚瞓覺都係5點幾喎，點解今朝一早出嚟就7點幾？因為你準備打仗啊嘛，咁啊 stress 咪開始你個血糖上升啦。Also, you have to continue measure your other medical issue, like for example, your cholesterol. If your cholesterol continue goes up, you know what? There are more chances for you to add up your blood sugar to become very thick, will mix in terms of your blood sugar and cholesterol, that you will plug up more, your blood pressure goes up. So all that has to be continually managed, and you might have to talk to the doctor, take cholesterol pills, and also take blood pressure pill. But more important, actually drink Lowsutea, because Lowsutea definitely will help you to lower your cholesterol and also lower your blood pressure. Now, very interesting. I have quite a bit of clients now. They say, hey, I'm taking a lot of cholesterol pill, but my cholesterol doesn't come down. But I introduced Lowsutea. After that, the cholesterol start coming down. And because really at the end of the day, they dump excess cholesterol out the urine. So it really helps to bring it down, the bloodstream, okay? So important to drink Lowsutea. Is really going to help to lower cholesterol. Certainly, after that, your diet control, your exercise also will help. But a lot of people, after took the pill, the cholesterol doesn't come down. But drink Lowsutea will help, okay? 嗱，各位朋友，你要管制咧，仲有一樣嘢就係你個膽固醇啦，同埋血壓啦。嗱，好多人食咗藥嘅膽固醇咧都唔跌落嚟喎，但係飲咗血糖茶咧就開始慢慢跌嚟。因為點解咧？佢因為嗰個尿咧就掉咗啲 excess 嘅cholesterol 出嚟，咁個血糖嘅 cholesterol 個血嘅膽固醇咧就可以降低啦。佢要降低咧，個血壓亦都會降低嘅喎，因為佢鹽掉咗落咗啦，咁你嘅血壓亦都會降低嘅。咁當然啦，你仲要做幾樣嘢，記住頭先做咩？要 exercise 啦 ，burn 多啲血糖啦 ，exercise 亦都降低你膽固醇同埋血壓嘅。咁所以咧，其實我做呢嘢一齊會降低嘅。Now, importantly for pre-diabetic diabetes, you have to do the same thing. You have to manage your stress. Because stress is actually bad for everybody, because even pre-diabetic or diabetes doesn't matter, because stress increases what? Blood sugar. The body will tell you, wow, I'm stressed, I'm ready to fight, so I will give you more sugar to fight. So your blood sugar goes up. So your body will react to stresses by giving you more sugar. So you need to basically more relax and basically not to get a lot of stress. Because you got a stress hormone come out, which you link out are more even insulin resistant, and plus your blood sugar will start going up. So when you do stress, it's not going to help you, because with stress also your blood pressure is going to go up. Everything goes up because the body is ready for you to fight, right? So managing stress is important by basically, listen more class, slow music, do yoga, all the little things to relax you, make all the difference, okay? Or even massage, okay? So very important, manage your stress. 嗱，壓力管理係好緊要嘅，因為你唔係壓力管理咧，你個人咧就會係好 stress 啦，高壓力啦，你糖就會上升，因為身體話：哇，你準備打仗，我俾翻糖你。咁但係俾多糖嘅時候對你又唔好啦，因為你血糖上升嘛。 所以 manage stress 係好緊要。咁啲 manage stress 啊，咁可能你要做啲運動啊，做啲 yoga 啊，聽音樂啊，或者唔好做一啲東西嚟夠令到你好壓力好大嘅，要靜啲，咁亦都 OK 嘅。你可以睇下電視、讀下書，唔緊要，但係最緊要降低你嘅壓力。OK。One of the things that you might ask, well, what else do I have to do? Well, Lowsutea definitely help you. Adding in your diet, drink 6 to 8 cups of Lowsutea per day will help you if you are pre-diabetic, if you are high cholesterol, if you are high blood pressure, if you are already diabetes, all that, drinking Lowsutea definitely will help you lower your blood pressure, blood cholesterol, and blood sugar, and detox. And all that will help you. So make sure add Lowsutea is part of your diet. And so you can able to experience and measure yourself in about 2-3 months. You will see, wow, my blood sugar came down, my cholesterol came down, and my blood pressure also came down. And my leg also came down. So all that you will see. So you can motivate yourself and do that. Okay, in summary now, if you have your lifestyle change, you basically lower the risk, become a diabetic if you are pre-diabetic. And you will able to lower your diabetic conversion risk. And if you are diabetic already, it will help you to reverse you to become a pre-diabetic. Isn't that wonderful? And basically, the way how you do that is you're going to have really change your lifestyle. And change your lifestyle, including your diet control, like the meal plan. You have to eat more fiber, low fat, low carb diet. That is something that you got as a must. Either pre-diabetic, diabetes, the same thing. You have to do that. You have to monitor blood sugar, because in order for you to only know how am I doing, you have to measure blood sugar, because if not, you will not be able to tell. Use one of these machines. It's called Camellia. Then you can see I'm only 5.7. Okay, you can measure, poke your finger every day, doesn't matter, but you gotta really know. And you go to the doctor, you say, hey doc, what is my A1C? And you have to drink Lowsutea daily. 8 cups a day will help you really lower blood sugar. You will definitely see that. And on top of that, you drink 2 liters, you will always be hydrated, so your blood becomes not too thick. If your blood becomes thick, you will be really have higher blood sugar, plus all the plugging of the whole body. And you have to exercise daily, 30 minutes or more a day, total 150 minutes for a week. You can walk about, exercise at the shopping mall, it's okay, but it's really important you can relax yourself walking, burn up some of the sugar, lower your blood sugar. You have to maintain a healthy weight. And what does that healthy weight mean? Meaning that you have to be, if you're 30 BMI, higher, manage yourself, lower 10% of your weight, you lost 1% A1C. Isn't that great? And then you reduce the sugar intake. In other words, any kind of high carb stuff, hey, cut it off. Or eat very little. So that way you don't have high blood sugar in there. If you smoke, you stop smoking, and not to have wine or so much alcohol intake. That will be really help. If you do all that, most likely you can continue to maintain yourself pre-diabetic. If you have diabetes already, if you do all that, it will help you bring yourself down to the pre-diabetic stage. Diabetes to pre-diabetic, that's really wonderful. A lot of patients of mine who are 10 A1C with a 10 plus brought it down to 6 and below. And they now continue to maintain below 6.4. So they will have less chances to have diabetic complication. Isn't that wonderful? I know you can do it. And all you got to do is just say, yes, I can do it. 各位堂友，嗱，好簡單嘅，你一定要用你嘅生活習慣咧，改變咗你個低糖嘅即係前期患病嘅風險嘅，而唔會就算你依家糖尿病病，你都轉翻去你個前期患病嘅情況嘅。咁其實好簡單，就係你要食多啲纖維嘅食物啦，低脂肪嘅食物啦，同埋低碳水嘅食物。咁邊樣嚟講，你做咗呢樣嘢之後咧，你嘅糖一定會降低嘅。咁同埋咧，你仲有監控，就係要睇你個每日度糖啦，或者用呢個機去度糖啦。咁我或者要問下醫生 A1C 幾多啦。咁 咁呢個你都繼續了解你係 A1C， 但係呢個有個機器咧，你咪度嘅時候或者篤手指咧就好方便咯喎，咁我即刻知道咯喎，係嘛？咁每日都要飲咩啊？去糖茶，因為去糖茶真係幫助你降低血糖。嗱，呢個唔係藥嚟嘅，呢個係睇一個食物嚟嘅啫。咁呢個食物你飲咗去咧，能夠降低血糖係好緊要嘅。咁你就變咗日係咁降低血糖啦。咁變咗咩啊？飲咗血糖去糖茶之後，仲要增加咗啲水分上升啊。咁你變咗啲血就冇咁結啦，糖分低咗，又有 detox 啦。仲有每日咧，你做啲運動咧，又 burn up 啲血糖啦，又保持你身體嘅重磅啦。如果你 BMI 過咗30，日日做運動咧，你食嘅嘢係低咧，即係你 carb 低咧，你一定會降低磅嘅。如果 under 你減咗10% body weight 咧，你 A1C 係減1%嘅，所以好正。咁同埋咧，仲要咧係要唔好食咁多，唔好食煙啦，或者如果你係飲酒咧，千祈唔好飲咁多，因為酒係一樣可以增加你上升嘅。咁同埋啦，仲有啦，要控制你食糖嘅東西啊，即係好多甜品啦，唔好食咁多煙啦，因為食好多甜品咧，亦都會真係降低將你血糖上升嘅。So 如果你做晒呢咁嘅嘢咧，你一定係能夠令到你控制咗，你唔會變咗前期患病去糖尿病啫，或者糖尿患病啫，亦都能夠 bring 到佢翻嚟咧係前期患病。So remember，if you have pre-diabetic or diabetes, you know what? It's a chronic disease. You don't get well, you only can control. In other words, even you are pre-diabetic right now, if you don't do anything, you'll be diabetes. If you don't get well, you gotta control. And in order to control, to prevent this serious disease, you have to control blood sugar. And you are pre-diabetic, and you're the same thing like diabetes, the same thing. It's the same technique that you have to continue to do that basically with proper dieting, exercise, weight management control, and drink Lowsutea. It's the same thing. So your lifestyle change is more important. Make sure you don't put a lot of white food like flour, white bread, soda juice that cut off. When you do all that, I'm very sure you can keep yourself healthy. So today, thank you very much. I think I run through a pretty comprehensive idea. Pre-diabetic diabetes is the same scheme. Only thing in diabetes, you have drugs to take at the same time, and you can still do what? Lowsutea together. There are no contraindication. You can do that. And hope that with that, in 20 years, you continue to move yourself down to pre-diabetic state. In other words, your A1C is lower than 6.4, maybe hopefully 6. Wow, you'll be so much more healthy. A chance of you eliminate the complication is wonderful. I think that will be super, super good for you. 嗱，各位朋友，如果你係每日係能夠幫助你自己降低血糖，唔會變咗一個前期患病，或者去一個糖尿患病者，或者如果糖尿患病者變翻係前期患病者，哇！你身體健康，呢個係只係能夠控制嘅，就唔會醫治好嘅，記住啊！咁呢個控制啦，咁你一定食啦，運動啦，同埋咧要降低磅數啦。咁如果你做晒啲嘢咧，你一定會變咗係繼續係將你嘅糖尿病咧係控制得好嘅。如果你20年後都係能夠控制到咧，你身體好健康，會有好大嘅損壞。咁所以變咗嚟講咧，你記住糖尿病係唔會好嘅，前期患病亦都唔好嘅，只係能夠控制，唔會變咗糖尿病。因為如果你唔控制，一定會變咗糖尿病。所以希望各位繼續努力，繼續飲去糖茶，幫助你係降低你個糖尿病風險，或者降低你其他嘅前期患病嘅風險。咁呢個咧係希望你繼續努力 ，OK？ So I don't know anybody have any question. You can actually write to me. As you know, now we have Lowsutea Hawaii in the Facebook. You can actually buy this on Arena and Gordon or people from Hawaii. You can actually buy the product from Lee Ohana, Tommy Place. So let us know what you need. If you have any question, do write to me, Andy@wafong.com. Hopefully you can have any question. And I think if you have any question, do drop me a note, because I know a lot of people actually drop me a note. And a lot of people actually ask me questions like, hey, you know, my cholesterol is high, what do I do? And some of the question they ask is basically just didn't know how to ask the doctor. And after ask doctor, they got the answer. They said, wow, thank you very much. So do ask question, especially what is my A1C? That's so important. Okay. So are there any question? If you don't have any question, I do wish you everybody a very nice holiday for Saturday. I appreciate spending a valuable time for us to learn about just diabetes and pre-diabetic. Although you might heard this before, but more you hear, more you remember. So with that, I think you can keep yourself much healthier. Okay, thank you again, and I appreciate the time you're spending with us. I will see you next week. Okay, thank you. And write to us and send us WhatsApp. You need to. And this is our number contact. And also we have a lot more education. Yeah, thank you very much, Pat. Give me some more likes if you can. You give me a couple more likes. I would greatly appreciate that. That would be wonderful. Give me a like. And that would be really real cool. People from WhatsApp. You have no question, will give me a like, and that will be really good. And I think that a lot of people, yeah, Pat, give me a like, just give me a like, and that will be wonderful. All right, thank you again. I appreciate your time. Looking forward to see you next week with a different topic, and I'll send you this information later on. And also, we will send you the replay also. You can share, feel free to share with your friends. Who are not who are maybe busy can hear our lecture. 各位同學俾個 like 我啊，喺你個 Facebook 嗰度，如果係嘅話，咁如果你係需要多啲 information，全問我哋啦，咁我哋亦都會答你啦。咁亦都有喺呢度寫 WhatsApp 俾我啦，俾個電郵俾我啦，或者 WhatsApp 嘅電話俾我哋啦，都 OK 嘅。咁我哋好樂意咧係答你嘅問題。咁多謝你繼續聽我哋講書啦。咁希望你繼續努力咧。係降低血糖。OK，goodbye，thank you。